She had followed every piece of advice. Eleanor was 68 when she first walked into my office. In the 2 years before our appointment, she had consulted 3 different doctors. Each one had run tests. Her thyroid came back normal both times it was checked. Her iron levels were on the low side of normal, so she was prescribed supplements. She was taking melatonin at night because she never woke up feeling rested. She had been told that her constant tiredness was probably just part of getting older. Maybe a touch of depression, maybe the difficulty of adjusting to retirement and a quieter life. She was encouraged to move more. She did. She still felt drained every single day. When I sat down with Eleanor and looked at her full story, not just one symptom here and another there, but everything together in the order it had appeared over time, something felt off. The iron pills weren't raising her levels the way they should have. The melatonin wasn't fixing her sleep. She had developed a strange pattern of bloating that would vanish for a week, then come back for a few days, then disappear again. And then she mentioned something almost in passing, something she had never told the other doctors because she didn't think it mattered, an annoying itch, mostly at night. She figured it was just dry skin. I asked her one question that nobody had asked before. When was the last time anyone had checked what was actually going on inside her digestive tract? Not with a colonoscopy, not with a standard test for common bacteria, but with a real investigation for parasites. The answer was never. 3 weeks later, after a thorough stool analysis, we had our answer. This isn't a story about Eleanor being unusual or unlucky. It's a story about a blind spot in how we approach fatigue, digestion, skin problems, and all those small signs the body sends out over months and years before anyone thinks to look in the right place. That blind spot is what I want to talk about today. Intestinal parasites are not, as most Americans assume, a problem that only exists in faraway countries with poor sanitation. The World Health Organization estimates that more than 1.5 billion people carry soil-transmitted worms at any given time. That number doesn't even include protozoal infections, organisms like Giardia and Entamoeba, which are found in water and food across North America and Europe every single year, even in places with modern plumbing. Giardia alone is the most commonly diagnosed intestinal parasite in the United States. I'm not telling you this to scare you. I'm telling you because the belief that this couldn't happen to you, that your lifestyle or your neighborhood protects you, might be exactly why the right question never gets asked. There are 5 signs I want you to keep in mind. Not because having all 5 means you definitely have a parasitic infection, but because each one, especially when they show up together, when they come and go in cycles, or when they stick around despite treatment for other causes, deserves a closer look. The first is fatigue that doesn't get better with rest. This is a very specific kind of tiredness. It's not the normal exhaustion that fades after a good night's sleep. It's the kind that's there when you wake up, as heavy as it was the night before. People describe it as a weight, like something is using up their energy before they even get a chance to spend it. After 60, this gets easily dismissed. Age is a convenient excuse, but when fatigue lingers for weeks, when it comes with gut issues, when it shows up alongside blood work that shows slightly low iron or B12 with no clear reason, I want to know what's happening in the digestive system before I accept aging as the explanation. The second sign is digestive problems that come and go in cycles. Constipation for a few days, then loose stools, then a week of normal, then back again. People get used to this pattern. They change their diet. They try probiotics. They drink more water. Some of it helps for a little while, but the cycle keeps going. I've seen this pattern in patients whose gut is responding to organisms that have their own rhythms, cycles of reproduction and feeding that the digestive system reacts to in waves. It's not proof of anything on its own, but it's a pattern worth paying attention to. The third sign is a strong craving for sugar and refined carbs. This one surprises people. They expect me to blame it on stress or habit or blood sugar problems. All of those are real possibilities, but certain parasites rely heavily on sugar for energy. They can also interfere with the signals between your gut and your brain that control appetite. I'm not saying that craving sugar means you have parasites. What I am saying is that when someone over 60 suddenly starts craving carbohydrates more than usual, alongside fatigue and digestive cycles, with no major change in their diet or stress level, that combination deserves a second look. The fourth sign is skin problems that don't have an obvious cause. Eczema-like patches, hives that appear and disappear, adult acne showing up for the first time or coming back after years, unexplained itching on your arms or torso. These can all have dermatological explanations, but your gut and your skin talk to each other through your immune system more than most people realize. When the gut's protective barrier is damaged, which is one of the things certain parasites can cause, the immune system can react in ways that show up on your skin, even when your digestion seems fine. And the fifth sign is the one Eleanor was too uncomfortable to mention: itching around the rectal area at night, the kind of itch that most people blame on hemorrhoids or dry skin or something they ate. This is the classic symptom of pinworm infection, a surprisingly common parasite, especially in adults who live with young children or grandchildren. Female pinworms move to the skin around the anus at night to lay their eggs. The itching is your body's reaction to that movement. It's very specific, and it's almost never brought up in a doctor's appointment unless the doctor asks directly. These 5 signs, taken one at a time, don't mean much, but together, with the right medical history, they form a strong reason to look deeper. Here's what frustrates me about how this is usually handled. When a doctor orders a stool test for a patient with digestive complaints, what they usually order is a stool culture. A stool culture looks for bacteria, Salmonella, E. coli, Shigella, Campylobacter. It does not look for parasites. It does not look for parasite eggs, cysts, or larvae. To find intestinal parasites, you need a different test, a stool over and parasite examination. And even that test has limits because parasites don't shed eggs continuously. They do it in cycles. A single sample on a single day can come back negative even when an infection is present. Most medical guidelines recommend testing at least 2 or 3 samples collected on different days. Giardia and Cryptosporidium have their own antigen tests that are more sensitive, and those need to be ordered separately. They're not part of a standard stool culture. This is the gap I keep coming back to. A doctor sees a patient with fatigue and digestive issues. They order blood work, they order a stool culture, the results come back normal, and the conversation moves on. The right test was never ordered, not out of carelessness, but because the possibility simply didn't occur to anyone, because parasitic infection, in the minds of most American doctors, belongs to a different kind of patient. After 12 years of practice, I've seen this pattern over and over. I've worked with patients who were put on antidepressants for mood changes caused by unrelenting fatigue, patients who tried 3 different iron supplements without their levels improving, patients who were told their digestive problems were just IBS when the real answer was sitting in their gut, undetected, because nobody asked for the right test. This is where I have to gently disagree with a common approach in medicine. treating each organ separately instead of looking at the whole system. The gut is not a collection of unrelated problems. It's an ecosystem. And if something is living in that ecosystem that doesn't belong there, you can't fix the problems it causes by treating them one by one. Think of your gut as a piece of land. The lining of your small intestine, if you flattened it out, would be about the size of a tennis court. It's covered in tiny finger-like projections called villi, and those villi are responsible for absorbing every nutrient your body needs: iron, B12, zinc, magnesium, and fat-soluble vitamins. They're also your first defense against whatever you eat. Now imagine what happens when an organism moves in and starts competing for that space. Worms, roundworms, hookworms, tapeworms, pinworms attach themselves to the intestinal wall. Some, like hookworms, feed directly on your blood. Others eat partially digested nutrients before your villi can absorb them. A moderate hookworm infection can cause enough blood loss every day to create iron deficiency anemia that doesn't respond well to iron pills. Not because the dose is wrong, but because you're losing iron from the inside. Tapeworms are especially good at draining your B12. You can take supplements and see a small improvement, but your levels may never stabilize because the worm is getting to the B12 first. Protozoa, like Giardia, work differently. They don't burrow into the wall, they coat it. A heavy Giardia infection creates a film over the absorbing surface of your small intestine, blocking your villi from the nutrients passing by. The result is malabsorption that can affect fats, fat-soluble vitamins, and carbohydrates. Giardia also weakens the tight junctions between intestinal cells, the microscopic seals that keep the contents of your gut where they belong. When those seals break down, your immune system activates, creating low-level inflammation that doesn't scream for attention, but slowly contributes to fatigue, brain fog, and immune problems. This is the cycle I want you to understand, because it's the part most people miss. Parasites drain your nutrients. Low nutrients weaken your immune system. A weak immune system lets parasites thrive. More parasites cause more inflammation. More inflammation damages your gut lining. A damaged gut absorbs less. Less absorption creates more deficiency. Your body keeps sending signals: fatigue, skin changes, mood shifts, the feeling of never being rested. But because each signal is treated separately, the fatigue gets a pill, the skin gets a cream, the mood gets a prescription, and the cycle continues. There are 4 things that change in the gut after 60, and each one makes it easier for unwanted organisms to settle in. The first is stomach acid. Your stomach acid is a powerful barrier. When it's working well, it kills many pathogens before they reach your intestines. But as you age, your stomach often produces less acid, a condition called hypochlorhydria. This is made worse by the widespread use of acid-reducing medications like proton pump inhibitors and H2 blockers in people over 60. These drugs lower stomach acid on purpose to treat reflux, but they also lower one of your gut's main defenses against ingested organisms. I'm not telling you to stop your medication. I'm explaining the mechanism because understanding it matters. The second is gut motility. The contractions that move food through your digestive tract slow down with age. Food and anything that came with it spends more time in your system. That extra time gives organisms a better chance to settle in. Slower motility also contributes to the cycling pattern I described earlier, the back and forth between constipation and loose stools that many older adults experience and accept as normal. The third is immunosenescence, the aging of your immune system. This isn't a failure, it's a natural change, but it means that the constant monitoring inside your gut, the surveillance that identifies and removes foreign organisms, becomes less responsive. Infections that a younger immune system might have cleared without any noticeable symptoms can take hold more easily after 60. And the fourth is the microbiome. A healthy, diverse community of gut bacteria creates a competitive environment. Good bacteria take up space and produce substances that make the gut unfriendly to invaders. Research from the National Institute on Aging has shown that gut bacterial diversity tends to decline with age. A less diverse microbiome is less resistant, and a gut that's already been disrupted by antibiotics, dietary changes, or chronic stress is even more vulnerable to the kind of disturbance that parasites cause. None of this means that everyone over 60 has a parasitic infection, but it does mean that if your body sends these signals, especially after travel, after drinking water from an uncertain source, after a stomach bug that never fully went away, the threshold for investigation should be lower, not higher. Let me slow down here because I've given you a lot of information, and I want to make sure the practical part is clear. First, if you recognize several of the signs I've described, fatigue that doesn't improve with sleep, digestive cycles, unexplained nutritional deficiencies that don't respond to supplements, nighttime itching, or skin changes with no obvious cause, please bring this up with your doctor. Don't wait for them to bring it up. Ask specifically for a comprehensive stool, over, and parasite examination, collected on 2 or 3 separate days. If Giardia is a possibility, ask for a Giardia antigen test as well, because the standard test misses it in a significant number of cases. Some doctors will be familiar with this. Others will need you to ask directly. I know some of you hesitate to speak up in a medical appointment. You're not being difficult when you ask for a specific test. You're giving your doctor useful information, a pattern of symptoms that calls for a particular kind of investigation, and you're asking for the tool that addresses it. That's not overstepping, that's taking part in your own care. Second, if a parasitic infection is confirmed, especially a worm infection, it usually requires medication. There are effective, well-tolerated antiparasitic drugs, albendazole, mebendazole, metronidazole for protozoa, that work. The natural approaches I'm about to discuss are supportive and preventive, and I believe in them, but I want to be direct. If you have a confirmed infection, treat it with your doctor. Don't replace a prescription with herbs. Third, if your test comes back negative but you still have symptoms, that doesn't close the case. A single negative result doesn't rule out infection. It just makes it less likely. Keep the conversation going. My father grew up in Lebanon, and I remember him standing at the kitchen sink every Sunday morning, soaking the vegetables we'd bought at the market in salted water before anything else happened. He never explained it beyond saying, "You don't know what traveled with this." He was a careful man. I thought about him often when I started reading the research on natural anti-parasitic compounds, because some of what science is finding about these plants isn't so different from what generations of traditional knowledge had already figured out. I want to walk you through 4 of them. Garlic contains a compound called allicin, which forms when raw garlic is crushed or chopped. Multiple lab studies have shown that allicin has activity against a range of intestinal parasites, including Giardia and certain Entamoeba species. For this to be useful, the garlic needs to be raw and it needs to be eaten soon after preparation. Allicin breaks down over time, and cooked garlic produces much less of it. A half clove to a full clove of raw garlic, chopped and left to sit for a few minutes before being added to food, is a practical way to include it regularly. This is not a treatment for an active infection. It's a reasonable addition to a gut-supportive diet. Pumpkin seeds have a long history of traditional use against intestinal worms across many cultures, and there's now some research to explain why. The active compound is cucurbitacin, which appears to temporarily paralyze certain worms, making it harder for them to hold onto the intestinal wall. Studies in animals and some small human trials have shown measurable effects. The amounts used in traditional preparations are not small. We're talking about a good handful of raw, unsalted seeds, not a sprinkle on a salad. Consistency also seems to matter. One day of seeds doesn't do what a few weeks of regular use can. Clove is the one I find genuinely interesting in this context because its activity seems directed specifically at the eggs and early-stage larvae of certain parasites. Most anti-parasitic interventions, both conventional and natural, work against adult organisms. Clove is one of the few natural compounds with demonstrated activity against the earlier reproductive forms. Eugenol, clove's main active ingredient, has been studied for this specifically. If the logic holds, and I want to be transparent, that much of this research is still early, then clove's role is less about eliminating the adult worm and more about breaking the cycle of reproduction. And ginger does several things at once that are relevant here. It has documented antimicrobial and anti-inflammatory properties. It improves gut motility, which helps with mechanical removal, and it supports the protective lining of the gut in a way that appears to counter some of the damage that parasitic infections cause. It's also one of the most tolerable daily additions, whether in tea, in cooking, or as a supplement, with a well-established safety profile even in older adults. What I want you to understand about these four is that they are not replacements for medication. They are not precise, potent, or reliable enough to serve as treatment for a confirmed infection. What they can do, used consistently over time as part of a diet that also includes plenty of fiber and water, is make your gut less hospitable to invaders, support your immune function within the gut lining, and contribute to a daily environment that's harder for organisms to exploit. Fiber deserves a special mention. Soluble fiber from sources like oats, flaxseed, and cooked beans acts as what I often describe to patients as scaffolding for everything the gut does. It slows digestion appropriately, feeds beneficial bacteria, and binds waste products for removal. When your gut is trying to clear an unwanted organism or recover from having hosted one, fiber is the unglamorous, reliable support that makes everything else possible. Most adults over 60 eat far less fiber than their gut needs. I want to give you clear guidance on when these signs cross into something that needs prompt medical attention, not just observation. If you have unexplained weight loss along with fatigue and digestive symptoms, see a doctor soon. If you have visible blood in your stool or stools that are consistently pale, greasy, or unusually foul-smelling, that also needs prompt evaluation. If your fatigue is severe enough to interfere with your daily life, if you genuinely can't do things you could do a year ago, that's not something to manage at home. If you've recently traveled, especially to areas with less reliable water treatment, or if you had a stomach illness in the past few months that seemed to get better but left you with ongoing symptoms, fatigue, bloating, irregular stools, that combination is a clear reason to get tested. And if you're immunocompromised for any reason, including medications that suppress your immune system, The threshold for testing should be lower, and the conversation with your doctor should happen sooner. The purpose of everything I've shared today is not to replace that conversation. It's to help you walk into it better informed, more specific about your symptoms, and clearer about what you're asking for. That makes a real clinical difference. Here's what I keep coming back to after 12 years of these conversations. Your body doesn't send vague signals, it sends specific ones. Fatigue that doesn't respond to sleep is a specific signal. Digestive symptoms that cycle on their own schedule are a specific signal. Nutritional levels that don't improve with supplements are a specific signal. The problem isn't that your body is unclear. The problem is that we've gotten into the habit of sorting those signals into separate boxes. Fatigue goes in the energy box. Digestion goes in the gut box. Skin goes in the dermatology box. And nobody steps back to ask what might be connecting them. In cases like Eleanor's, what connected them was something that simply hadn't been looked for. She got better. Her iron levels normalized. Her sleep improved. The cycling stopped. Not overnight. These things take time, and they require proper treatment followed by real rehabilitation of the gut environment. But she got better. And at a follow-up appointment, she told me that for 2 years, she had been told her problem was just her age. She was 68. She had decades ahead of her. That's the part that stays with me. Take care of yourself. Pay attention to what your body is telling you. Thanks for watching, and I will see you in the next video.